Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today I'm joined by Royan Kamyar from faraway San Diego, California. Thank you so much for being with me across the country today.
Of course. Thanks for having me.
So we met a couple of times, I think. Didn't we meet first in Vegas and then at AI Med?
I didn't make the Vegas conference. Which one was that? Not by
Were we messaging about meeting at the health conference and then it didn't work out? Is that what happened?
Right. And we met at AI Med in San Diego.
Yes. Where you won an award, I believe, in the Shark Tank, right?
Yeah, we came in third place on the pitch contest.
Yeah. Hey, well, it's Olympic season, right? So everybody's
I'll take
into
the
these
bronze. Yeah, we were happy
medals.
about
You
that.
got the bronze award. Do you have
Yeah,
it with you?
I do actually. It's back
Oh,
here.
show me. Because I wasn't in that part of the session. So I'd love to see it.
There it
Woo!
is.
I was wondering if it was made of bronze.
No, it's
We
made of
will
plastic.
accept. Third place on the Shark Tank.
That's
That's what's
right.
up. I love that. Yeah, you got to keep that where people can see it. That's pretty
I
exciting.
know. Yeah, I'll keep it up.
So tell us about what you got your award for, Owaves. What is it?
Sure. Yeah, it's a startup. It's a company that we've been working on, and essentially it digitizes lifestyle medicine. It became a huge Dean Ornish acolyte over the years, and also brings to life circadian biology. And so it's a digital platform. It's a calendar, but it's really meant to help people optimize their circadian rhythm around these key lifestyle medicine behaviors like exercise, sleep, nutrition. And we're mostly focused on college students. We have over 1 million downloads, and that's where we see the most traction. And we're really kind of capturing this lifestyle psychiatry movement and focusing our indications on mental health. So our first prospective RCT with UC San Diego is focused on mental health outcomes for college students.
Yeah, that's so exciting. And so you are a physician, you went to med school, and then you went
Sure.
back to get your MBA at Rady, is that right?
At UC San Diego. Yeah.
At UC San Diego. And then, so that really, how did you come to kind of pivot into business from medicine?
I come from a family of physicians. So medicine was sort of always in the cards. Older sister, both parents, uncles, aunts, cousins, now wife and brother-in-law, and so on. But I always wanted to start a company. So it was kind of always the idea to combine, an MD and MBA in terms of the sort of series or format in terms of how that came to fruition. Originally I was looking at combined MD MBA programs. Eventually decided to finish medical school, do my intern year, get my license, and then jump into an MBA program. And UC San Diego was kind of brand new campus because they didn't have a business major when I left San Diego. I'm from here. But when
Oh,
I found out they kind of developed this business school, which was really positioned at the intersection of entrepreneurship and life sciences, I took the chance and jumped all in and have been here ever since.
yeah. You said you always knew you wanted to start a company. Were you pretty entrepreneurial when you were growing up?
I mean, yes and no. Like my parents are pretty conservative. And so, in our culture, like salesmanship wasn't necessarily an aspirational trait. Like it was not polite to try to sell things to your cousins or your uncles or aunts, right? So that was a little bit not encouraged. But I love the idea of having your own lemonade stand and, always wanted to invest in stocks. So I just love business. Uh, but, again, I came from a family of physicians. So it was really, med school you know, or bust.
If you're going to be part of this family, you have to go to
Exactly.
med school.
Pretty much. Yeah. That's the ticket. You have to, pay the price. But, I had a really good mentor at UC Berkeley who kind of like helped me think about originally biotech. So I was thinking of like, drug discovery, stem cells, genetics. But it wasn't until my medical intern year when I realized how much we ignore prevention as a field and the irony of wearing a white coat and telling people, patients to take good care of themselves. It was just so thick, especially I did my intern year in downtown Manhattan and we had, easily the worst lifestyles, and we were basically trying to, teach patients how to lower their blood pressure and their cholesterol, et cetera. So I became really passionate about lifestyle as medicine. And really, I was applying it to myself first when I started my MBA program. I was pulling out my trusty notebook and just kind of drawing out my day. And I started thinking about, okay, I only have 24 hours every day, but I know each 24 hours I need to allocate 7 to 9 to sleep, and I want to plan out my meals. I want to exercise for at least an hour. And so, to me, it became almost like an interesting formula that I had to fill. And
Huh.
the insight that we always only get 24 hours, like that rubric doesn't change. Those constraints are pretty consistent. And so we can kind of come up with this optimal formula, and that's kind of personalized and suits our needs. And then, actually at UC San Diego, they have one of the first and still only dedicated centers for circadian biology. And then that's when I realized how deep this kind of science and art of when you do things can go. And became really passionate about it. And yeah, so it's kind of brought me full circle till today.
Yeah. So calendar tracking has been used in a lot of different ways. Do you integrate with like the wearables that track your sleep and things like that?
Absolutely. So I use an Aura right now.
Mhm.
And actually, Dr. Ricky Blumfield is a pediatrician, chief medical officer, or just joined our clinical advisory team. So we're working
Really?
closely with wearables. I'm also using an Apple Watch, for example.
Oh, well, and I was gonna ask, I have a Whoop band. Would that sync up
Okay,
with it?
anything that integrates with Apple Health, we pick up and we
Oh,
can
okay.
input into our algorithm. So yeah,
Nice.
Apple Health really democratizes a lot of the wearable activity tracking.
Fantastic. Okay.
Yeah,
So then, for example, because like I'm using Whoop right now and it has a whole lot
yeah.
of things you can track in there. So what would that integration look like and what added insights could I get from the Owaves app as well?
Right. I think this is where it kind of gets into sort of our philosophy on positive lifestyle change, right? Which is not the same experience you would get from an activity tracker. Most, activity trackers, if you think about it, you pull out your app and you look at your dashboard, you're almost always looking backwards in time, right? You're kind of retrospectively analyzing your sleep, your stress score, whatever the case may be. But at its root, you're kind of looking backwards to see what your
Mm,
activity tracker is telling you the first half of your day or last night or yesterday. We believe, having been, kind of, coming out of my intern year in the actual trenches of positive lifestyle change, it, felt like I
mhm.
got hit by a truck during my medical intern year in Manhattan. And so I came out of it saying, okay, I need to take better care of myself. And how am I going to do this? It's a very prospective oriented experience, right? Like you're always planning, you're always looking forward. You're doing the grocery shopping to make the right recipes to get your right meal plan in place. You're packing your gym bag the night before, doing your laundry so that you have something. You put it in the back of your car so you can get to the gym at 3 p.m. later that day. It's a very planning oriented, forward looking experience. And so at root, we believe that the primary interface for positive lifestyle change is actually a planner or a calendar. If you look at Dean Ornish's recipe for lifestyle medicine, right, which the American College of Lifestyle Medicine has adopted, nutrition, sleep, exercise, stress management, relationships, the common denominator is time, hours and minutes. So they actually prescribe units of time. And so conveniently, the calendar or day planner becomes, again, in my opinion, in our opinion, the optimal tool for positive lifestyle change. So that's where you plan everything. That's where you're looking forward. That's your dashboard. And then the wearable activity tracking data, in my opinion, comes in secondarily to layer on top of that. So you can actually compare, here's what I intended to do. This is what I wanted to do today. Here's
This
what
is
I
what
actually did.
actually happened.
Yeah. And then that delta is, I think, the root of the conversation you need to have with a clinician or in this day and age, AI, right? Or some combination of their two to say, how do we bridge that gap?
Yeah. And tell it to give you very honest feedback.
Well, I mean, sometimes we're not honest with ourselves, right? If we think about it, like
Exactly.
if you go through the process of like, if I asked you, Rosa, what's your ideal day, right? Or what do you hope to accomplish, you know, uh, the rest of the day or tomorrow? You might be overly ambitious or kind of like think that you can accomplish, all these lists of goals that you might have in your phone collected over time in the next 24 hours, right? And so then we have to be honest with ourselves, like even something as simple as like, okay, I want to go to the gym, and then you block off 1 hour and you realize, oh geez, it actually takes me 15 or 20 minutes just to get my gym socks and t-shirt into a bag. And then it takes another 20, 30 minutes to get to the gym and like actually get behind some equipment. And now I have that hour to work out. And then there's another 45 minutes. So all of a sudden, 2 or 3 hours of your day is gone. right?
Yeah,
And
it's a
so kind of
bigger
being,
commitment
yeah.
than just that.
So I think, you're right. It's about being honest with like what we can actually accomplish over 24 hours. And I think that dialectic, where we're kind of always in this mode of self-improvement and we're trying to increment to this optimal version of ourselves, it gives us something objective to think about. And then coming back to your original question, like how does this compare with other platforms or kind of state of the art in terms of the clinic, right? I believe hours and minutes is a much more palatable metric for an average patient than millimeters of mercury, millimoles per deciliter, or, you name it, steps, calories, grams, like the list goes on in terms of the number of metrics we would expect a patient to monitor for primary care. If we can reduce that and boil it down to hours and minutes, I think we do a lot of people a good favor just to say, like, this is what you need to accomplish over the next 24 hours.
Like when you recommend that they get 30 minutes of exercise at 5 days a week.
I mean, that again, this is like a philosophical, I would say, difference between, how we approach things, which is like, okay, like, sure, you can keep reminding people that their blood pressure is above normal, which, they may already know, right? And so now you're in the business of telling them every day, okay, it's above normal. Um, and then unless they're on medication, maybe you're serving the purpose of flagging them when they need medication or they need to go up on their dose. But let's
Mhm.
say in the maintenance stage of that, if they're already taking their medication, I don't know how much additional value that creates besides actually going to what the intervention is itself, right? What you're really trying to tell them is to take better care of their blood pressure. And then the best ways to do that include these behaviors such as eating XYZ,
Mhm.
exercising, getting the right amount of sleep, managing stress, right? So how much of that daily interface needs to be reminding them of their current millimeters of mercury, right? Versus actually helping them accomplish these behaviors that underlie and, arguably a root cause for that metric, right? For the high blood pressure.
But, would you say that Gen Z is really, like, primed to take advantage of something like this? I know you said you're focused on your randomized control trials being on college students. That's still Gen Z, right? We didn't get to
Yeah, I
Gen
think
Alpha in
then alpha
college.
is kicking in, but yeah, technically you're probably still right.
Oh, good. Man, we're getting old fast. At least that's what my kids tell me.
I hear you.
I've got one who's Gen Z and one who's Gen Alpha, but I can't
Oh,
remember
okay.
what the cutoff is. Anyway, I was just thinking, Gen Z's prioritizing their health so much.
Yeah.
It's making huge waves in lots of different industries, like alcohol industry, for
There
example.
you go.
In another part of my life, I do a lot of food and beverage podcasting, and we've talked quite a bit about how much the alcohol industry has been impacted and seen a loss of
Fun.
profits due to Gen Z's not
Yeah.
drinking alcohol. Like
Right.
they want their health to be better. Maybe they're taking certain uh green leaves instead, but, but it is
Okay.
from all of
Yeah.
that evidence of the harms of alcohol, right? And so, if they're gonna be shifting entire culture waves with the shift from cocktails to mocktails, which we are now seeing in all these
Right.
different restaurants, then you can see that establishing healthy habits in their everyday life is incredibly important to them. So, is that part of why you started studying it in them, or was it more about availability of that's who was around you?
That's where we just got the loudest and clearest signal, because we've been out on the App Store for a few years now, and that's where the adoption was the deepest. And, they kind of self-reported diagnoses or issues with attention, so ADHD,
Mhm.
autism, depression, anxiety, and actually kind of the core use case, at least to date, has been around a concept called time blindness. So having visual structure over your 24-hour day, and something to actually guide you and kind of present as a roadmap for a healthy lifestyle, they find very valuable. So we gravitated to, Gen Z, Gen Alpha, because that's where we see the traction the most.
Mhm.
And then, the key value proposition is really around having visual structure and being able to better manage time, essentially.
Visual aids are very key to adopting new concepts, aren't they? So, That makes sense as well. Well, I think it's time for me to ask you the $1 billion question. Are you
Okay,
ready for this?
I think so.
Okay. So, Royan, if you were given a grant for $1 billion to meet a need that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
I think there's something really opportune around teaching lifestyle medicine to college students. It's the first time they leave the mother's nest, right? And they're essentially designing their lifestyle for the first time, typically in a new city.
Hmm.
And so if they're oriented when they come in through, those to a new campus, and the campus is immediately teaching them the importance of these principles around 7 to 9 hours of sleep, importance of meal planning and nutrition, the value of exercise in terms of all the outcomes they eventually care about, whether it's getting the best job when they graduate, whether it's creating, the greatest relationships, and achieving the highest GPA or becoming the best version of themselves, right? We know these lifestyle principles are so core to that experience and those positive outcomes. But I don't think this is getting taught. And so we know, for example, the happiness course at Yale became this oversubscribed, like, most popular class on that campus's history. And, similar phenomenon at UC San Diego now with their student wellness course. The students are craving this information, but there's nothing really, kind of nationwide, widespread to really get the word out on the importance of self-care and lifestyle medicine. And I think we know, as healthcare workers, and that changing behavior much later in life gets increasingly difficult, right? Because we kind of become embedded in these daily routines that may not be serving us well. So I think capturing students as they arrive to a new location and they're setting up shop and designing their own lifestyles for the next 4 years, teaching them the principles of lifestyle medicine. So a wellness course, and then leveraging all these devices and the latest and greatest technology and AI to help them measure and monitor their behaviors and actually gain insights and improve. And essentially, it would be like a, 1 credit pass no pass course nationwide. We would kind of do whatever funding is necessary to run the clinical trials and prove how efficacious it is and monitor over the course of 4+ years to study, graduation rates and the whole 9 yards. But really, empowering them almost as citizen scientists, and their body becomes like an N=1 experience during the 4 years, and they learn which behaviors get them to their personal health, wellness, productivity goals. And they can learn firsthand how things like alcohol, immediately disrupts your REM sleep and then ruins, the next day. And they can measure and monitor and learn that themselves with data and with education and curriculum to sort of support that.
So that's interesting that you say that there's not really this information being taught. I mean, there's people are watching YouTube videos about stuff like this all the time, but do you mean like there's a lack of a standardized authoritative source that's all in one place?
Yeah, I think I was hesitating to use those types of words like standardized and authoritative because I mean I feel like part of it is sort of discovering for yourself what sort of an optimal lifestyle looks like. But in a sense, you're right. Like I think first of all, like getting information through YouTube versus like through a university professor, we know is even now still has a meaningful difference in terms of how that information gets digested and to the degree with which you believe and immerse yourself in that type of content. I think the university setting still has an upper hand in terms of like whether it's considered the truth or really ultimately impacting your behavior because you're surrounded by colleagues and peers, and you're in a physical setting where you're paying high tuition rates to absorb this information. So I feel like and you're physically there on that campus to be taking these classes. So I think the gravity of that course would be much more significant if it was, in a sense, yes, mandated by the school. Like this is something that you do during orientation or that first year where you really taught them. Like, let's face it, like over 1 out of every 2 college students, by the time they graduate, they will suffer from a mental health issue, right?
Mhm.
Like that's just statistically, like you look left, you look right. By the time you graduate, one of you will unfortunately suffer from a mental health issue. And lifestyle psychiatry is kind of pushing the thesis that I think a lot of us believe, that you can actually get in front of a lot of these psychiatric issues with positive self-care. We sleep alone can be considered, a pretty powerful intervention for getting in front of a lot of, stress and anxiety. And so, if you really embody not just sleep, but the whole lifestyle medicine formula, whether it's relationships, stress management, exercise, proper nutrition, I think you'd see obviously, um, somewhat biased belief, but a huge decrease in the number of mental health issues that you see on campus if students really understood the power of these lifestyle interventions, and then tying that into circadian biology, right? Which is like this whole, chronotherapy has decades of research behind it. And so that to me is like, that combination of lifestyle medicine, circadian biology, um, is really synergistic. And then, if you can get, again, a whole class rallied around this, and all of a sudden there's like a peer support element to it, and
Yeah.
the university's encouraging it, I think, all of a sudden it becomes like an environmental, almost like blue zone phenomenon, right? So I think there's a lot that can be done
Yeah, that's cool.
with the 1 unit pass not pass student wellness course.
And we do absorb information so much better when it's in person than when it's virtual. I mean, I listen to YouTube videos all the time,
Right. Yeah.
and I might absorb some of them better than others, but it's so different than when, like you said, you're in a room physically with other people. And I think, I don't know if the classes you were talking about being oversubscribed, like the Yale happiness class or the equivalent at UC
Yeah.
San Diego were in person or virtual, it's a lot easier to oversubscribe if it's just virtual and everybody can tune in. But I love how you were talking about that key component of building those habits together. Because at first, when you're talking about it conceptually, you could insert that as like one session of everybody's let's see, when I got my first bachelor's degree, it was APSU 1000 what it was called at Austin
Okay.
Peay. And it's just your basic 101 entry to college. This is how you do college life. This is what's
Got it.
expected of you and all that stuff. And we met like once a week for an hour, and it was a 1 credit hour, but it was required. And so I think
Sure.
every
Yeah.
college has that. So my first thought was, well, why not just do it, incorporate it into that already exists, because it wouldn't necessarily have to stand alone. It's not like they're such high level concepts, but that would already give you that format of we're going to be in the same room with these people creating the expectations.
One of our advisors taught a course at UW where they essentially brought their own devices, their wearable devices, to the
Mhm.
course. He's the data science professor. And basically, they would, it was kind of like quantified self. I'm not sure if you're familiar with that movement, but,
Uh-uh.
they would be measuring their own, vital signs, or, whatever you can track with these devices. And they would bring that into class, and they would, do problem sets, or analyze their own data as part of the homework for the course. So it was essentially an entire course around analyzing your own wearables data, essentially,
That's
right? Your own
Hey, you know
behavioral.
what? Honestly, I need that. I would need
Everyone
that.
uses it, right?
Just
So like,
fully, like to really fully appreciate the heart rate variability and what does that even mean?
there
And
you go. It's a
yeah.
whole course. Like, you wouldn't be able to do that in a day. It's not like part of another course. And again, I think that already is kind of the root problem, is we're not giving this the amount of attention and merit it deserves. Like, this is like, the odds of becoming obese or overweight are just, 2 to 1, right? Like, your chances of becoming overweight or obese are greater than the chances that you have a normal BMI throughout life, right? We know that pre-diabetic or diabetic, like the odds are that you, gravitate in that direction, unfortunately, as on the standard American diet. And so, and then we come back to all these mental health issues that we're seeing on campus today. And so why not get in front of that? And, I kind of, again, in terms of like how much it becomes standardized or mandated, I feel like that's where, it feels like a little bit tricky, because, we have all these, I guess, I don't know how to put it, but like, there's like something that feels a little bit off about just like mandating it, but I think at least offering it, right? And I think if it's positioned appropriately, like, who wouldn't want to take that class, right? You just imagine that the default pathway is one of poor mental health and poor metabolic health, And there's a course that, again, we would use that $1 billion to prove out these endpoints. And if we could definitively say, taking this course, learning lifestyle medicine, applying circadian biology, that you can actually improve your GPA, lower mental health issues, lower metabolic health issues in a demonstrable way, which I believe would be the case, if again, if organized correctly, I feel like everyone would want to take that class. So maybe we don't have to mandate it, but we just prove out
Yeah.
the endpoint so that it's so compelling and powerful that any student would want to jump in, essentially.
And position the marketing to make them want it. Because if you do that right, they're gonna want it no matter what the actual endpoints are.
I mean, that's important because, it's just like healthcare, like in the university life, there's multiple stakeholders besides the patient, or in this case, the student. There's the parent, there's student affairs, right? There's potentially a student health insurance plan could or may not be involved. So anyways, I mean, you can imagine the parent might care more about like mitigating mental health issues, but the student as like an invincible 18-year-old may not want to invest, an hour a week and that sort of outcome. But
Right.
that's where the productivity marketing, right? The GPA promises. Actually, the same advisor I alluded to before, Ben Smar, he's now faculty at UC San Diego. He ran a study that showed aligning your course schedule with your chronotype can make a zero point 0.4 GPA difference. So it's half a letter grade. And I know
Oh,
every pre-med student, if they knew that, would totally select their courses accordingly. And so, and that would be the marketing to students, obviously, is performance and
yeah,
relationships. I think, it can have a huge upside there as well.
for sure. And maybe help with some communication issues. "Look how little sleep I got. I just don't have the energy for this right now."
And love is part of Ornish's formula, right? Like that's like now standardized as part of the lifestyle medicine, core pillars, right? Like you have to value and put hours and minutes into relationships. And,
Yeah.
people can easily forget that. And now tying it into health outcomes and, just imagine the mental health benefits from valuing and prioritizing relationships. And then, and then teaching in a course like this, like why it still matters to be face to face with people, right? Like why eye contact is important. Like sadly, we might have to learn that, in a textbook or a course, but we know now that we already went through the effort of sort of standardizing it as a lifestyle vital sign because it needed that to get people's
Yeah.
attention. And so now we have to teach it to students as well, that this is like a core pillar of a long, healthy life, essentially.
Well, and when you were talking about it being measured in minutes and things like that and investing that time in our relationships, if you're
Yep.
planning things out just like you're packing your gym bag. I remember I heard Jordan Peterson talking about marriage one time and how if you're gonna have a date night, you need
Mm,
to plan for having 90 minutes with your spouse to catch up beforehand to work through all the logistics of your life and like all of the stuff you've been waiting to talk about with the kids and
right. Get that out of
your
the way.
the
Yeah.
house and the bills and all that. And he's like,
Yeah.
do not be acting like you're gonna have a romantic date night
Yeah.
until you already had your 90 minutes of like life
Right.
management session
Flesh
and you're
it out
caught up.
first. Yeah.
So you could work that into your Owaves app of here's our 90 minutes of life management before we go on our date night.
100%. I mean, I think there's value in that, right? Because like we kind of talk about like our values, like, okay, I care most about my family, and then maybe second or third down on the list is work. But then when we look at how our buckets of time are getting spent, like inevitably a lot of us in healthcare, like that work category just outweighs by an order of, magnitude, whatever's going on underneath, whether it's family or anything else. And so that's part of what we help people visualize is like you may say that your family is the most important thing going on in your life, but then when you look at your schedule, you can see how much you're actually prioritizing your relationships.
Yeah, exactly. Well, I think that is really awesome because I really needed to think that through. And I love how you positioned it as far as the O waves is how you're looking out forward and you're
Yeah.
proactively planning. And then you can use devices like your wearables to look back at what actually happened and if it's measuring up to your goal so that you can work towards that. I love the synchronicity there.
I think it's about bridging that delta between, what you're planning to do and what you actually done. And then, I think there's a lot, as you know, in terms of like goal attainment and how to structure, you know, reasonable goals. And I think probably a lot of us are pretty poor at it, frankly, speaking for myself first, and then, just realizing how deep the science around goal attainment is. So I think even in getting help setting those goals, right? I think that's also like a core function of a good coach or clinician, or in this day and age, AI. You say you want to run a marathon in the spring, but like, how does that really jibe with everything else going on in your life? Like, is that you trying to run away from something, or is that actually a meaningful goal that we should start structuring your days to achieve? So yeah, I think in summary, you got it, but with the asterisk around, like, when we try to help you reach your goals, I think part of it is making sure those are the right goals for you.
Yeah, exactly. Well, that is so awesome. I really appreciate you sharing that with us today. And if someone is interested, how can they find O-Waves on their phone?
Owaves.com is spelled O like ocean, Waves, and we're in the App Store. It's called My Body Clock is the app title. So if you start Googling Body Clock or bodyclock.ai, you'll find us, but Owaves is the easiest way.
Yeah, it's it's pretty unique. I like that. And if someone wants to talk to you more about it or partner with you in some way, is LinkedIn the best way to get in contact with you?
Yeah, by all means. And my first name at owaves.com. So Royan at Owaves.
Awesome. And I will have your LinkedIn in the show notes. So, for those of you who are listening, if you enjoyed this episode of Nurse Rosa's Insights, be sure you like and follow, leave me a comment. Let me know if you know someone else with $1 billion idea that can transform the face of what health looks like in America. And make sure you check out my website, nurserosaspeaks.shop, if you would like to have me come speak. And I have a book out now. It's called Speak Up, Start Now. My goal is to make that the Nurses Week gift of the year and replace those rocks that say rock. So if you would like to check that out, it's available on Amazon, or you can just find it at nurserosaspeaks.shop, which is different from the .com. So, and I'll have all my links in the show notes as well. Royan, thank you so much again for joining me today.
Sure. Thanks for having me. It was fun.
And I hope you have some good rest tonight and keep up with your circadian rhythm.
Thank you. You too.
Okay. And I'll see you all in the next episode.